All right. Welcome, everyone, to the conclusion of the HealthTech Startup Week. Special thanks to our sponsors, especially the Blackstone Charitable Foundation, Blackstone Launchpad, Techstars, and Ucsf Innovation Ventures, as well as our numerous coaches, mentors, workshop leads, and facilitators. We are thrilled you're here, and we have 4 great HealthTech startup pitches lined up for you tonight, featuring students, trainees, and participants from all over the country. My name is Nate Prorock, and along with my colleague Jenny Jancy, we serve as the UCSF Launchpad Campus Directors. Launchpad Startup Weeks are designed for those early in their entrepreneurship and innovation journey. Almost all the participants entered this experience without any prior training or existing venture experience. Over the past 7 days, the participants experienced a very intensive and demanding entrepreneurial bootcamp, featuring workshops, mentor feedback and coaching sessions, networking, hours of market research, and endless collaboration, all culminating in tonight's pitch competition. Participants learned both the technical and interpersonal skills required to start a business, and in doing so, gained exposure to critical tools for success in their careers by being challenged to think creatively, communicate effectively, work in a team, and solve a self-identified problem. I am very impressed with how far each team grew their venture in such a short time. Serious kudos to all participants. You did a tremendous job. Without further ado, I will turn the virtual floor over to Susan, our fantastic facilitator.
Awesome. Thank you, Nate. That was the best intro. I don't even know how to follow that. So I'll go really quick through this. So happy to be here with you guys this afternoon and really looking forward to the presentation. So like Nate said, my name is Susan. I'm a facilitator for Techstars for Startup Week and Startup Weekend events. So for those of you that didn't hear my intro last week on Tuesday, this is something I've been doing for 5 or 6 years now, and I've done 12 or 13 of these events, and just love to, every time I'm amazed by how far the teams come over the course of a weekend or a week. So never gets old. Really excited for today, and glad you guys are all here to join us. So just a really quick overview. Nate gave a great overview of Startup Week and what the participants have learned this week. So just a quick note, again, for those of you that weren't here for last Tuesday. So Startup Week and Startup Weekend is a program of Techstars. You're probably all familiar with Techstars, or at least have heard the name. But in addition to the accelerators and the funds that they run, they also run a number of community programs, just like this one. So there are outstanding organizing teams all over the country that are putting on events like this in different cities all over the world every week and weekend of the year. So very cool organization to be a part of. And to our new 4 teams that are about to graduate, I guess, from the week, you are, 4 of many, many, many that have come before you. And so congratulations on now being, part of that really cool group. Just some numbers behind that statement. Techstars, in terms of their community programs, 400,000 participants since 2009 in 150 plus countries. So not even just a US thing. And just really a massive number of events and participants all over the globe. So that should give you just some idea of what you're now a part of and have been a part of this past week. So this is a big deal. I hope you guys will really take what you've learned and know that you've really gained some skills this week that'll set you apart and allow you to keep going down this path of entrepreneurship. So before we get into the pitches, we do want to do a final shout out to the people that made this event possible. And first up is the organizing team, Jenny, Nate, and Steven. Guys, give me some virtual applause or finger snaps for these 3. Organizing a virtual event, one that is spread out over a week, not an easy thing to do. These guys were so organized, so awesome to work with, brought in really great mentors and judges to help the team throughout the week. And thanks for putting this together. I know it's a lot of work that most people don't see, especially behind the scenes. So you guys are the best. Shout out. Also want to thank the mentors. Great lineup of mentors that were in and out this week, popping into team meetings to give advice and feedback. If you're one of these people and you're here with us today, thank you. I hope you had a great time. I know the team's really benefited from their mentor sessions with you guys. And then thank you to the partners. Nate did this a little bit, but both on the local level with Blackstone and with the different groups from Ucsf. And then also at a global level, the sponsorships that come through Techstars with Google for Startups and GoDaddy. If you were a participant and you have not yet taken advantage of your free domain from GoDaddy or your Google Cloud platform credits and you want those, message me in Slack and I'll make sure you know how to get those before the event is over. Okay, so before we really dive in, you don't have to answer out loud here, but as a participant, know you're in kind of nerves mode, getting ready to present, maybe putting the final touches on your slides right now, that's okay. But just take a second to reflect on what you learned this weekend or this week. So it has been 7 days since I met you all for the first time. And the first thing we did was half-baked. Do you guys remember? We built some businesses out of crazy words. And then the next thing we did was you guys pitched these ideas that are getting presented tonight to the group. And at that point, they were really not much besides ideas. And so no matter what you're feeling going into this demo day, there has been a lot of progress that has been made over the last week. And hopefully with that, a lot of skills and learnings that you'll take home with you, no matter what happens in these presentations. Okay, so last but not least, before we get to the presentations, would like you guys to meet our guest judges. So we've got pictures of them, although I think we might be missing one. But would love for you guys, judges that are here, if we'll just go down this row from left to right and have you unmute yourself and just do a quick intro of who you are and what you do, that would be awesome. Starting with Darren.
Yep, great. Thanks, Susan. Hey, folks.
Yeah.
I'm Darren Cook. I'm the executive director of the new Life Sciences Entrepreneurship Center on the UC Berkeley campus, dedicated to helping postdocs, grad students, faculty get life science ventures off the ground. Before that, I was the chair of the biotrack at UC Berkeley's Skydeck Startup Accelerator for 3.5 years, an instructor for the Nsfi, the NIH, and the I-Corps program at Haas, which is a lean Launchpad customer discovery type program. So good luck. Good to see you all.
Thank you.
Great. Yeah, my name's Charles Hart. I'm with the Catalyst program at UCSF, which is UCSF's translational accelerator that helps professors with ideas, discoveries, or inventions, advance them along the translational path to product development and patient benefit. And I've been at UCSF about 3.5 years. And before that, I spent 30 years in startup biotech companies in the Bay Area doing drug discovery, because I'm a molecular biologist by training. And I'm really looking forward to today's demo day. So I'll pass it over to Florence.
Hi, everyone. My name is Florence Lowe. I'm dialing in or zooming in from Dallas, Texas. And I'm the founder and CEO of a brand new firm called Alpha Genesis Labs. And we are building a cloud infrastructure support managed services practice with a team based out of that we plan to grow based out of populations that we don't normally see represented in technology. But I just exited from a software development partner company of 500 people that we sold to a private equity firm. And it's very exciting to be participating in this with UCSF. Thank you to Nate and Jenny for letting me join from Dallas. Very excited. Good luck, teams. Anam, I think you're next, if I'm saying your name right.
So hello, everyone. I'm Anam Koreshi. I'm actually an MTM alum. I know a few of you here are doing the MTM program at UCSF in Berkeley. So great program. I did my undergrad at UC Berkeley, was really involved in lean programs such as Lean Startup, Launch, and Nsfi course. Currently, I'm doing my day job at Intuitive Surgical. And then on the side, I do some consulting and help teach Lean Startup to high school students in community colleges. And yeah, excited to see you guys present today.
Awesome. Thank you so much, judges. And shout out to the organizers for selecting such a great and qualified crew to be our judges today. So for the judges, want to really quickly just go through the judging criteria. So these come from Techstars. It's the same criteria we do for every event. And then for participants, pay attention to, I know you guys have seen this already, but just a reminder so you know exactly what the judges are going to be looking for. So there's 3 pillars of the judging criteria that we'll ask you guys to think about when judging the pitches today: validation, execution and design, and business model. So a little more detail on each one. For validation, this is all about customer and market validation. So the question you should ask yourself as these teams are presenting are, did they get out and talk to customers? And are you seeing that customer feedback in the presentation? That could be interview quotes or survey results, whatever it is, that they get feedback. And does the feedback point to the fact that they're actually solving a problem for someone? That's huge. And who is it that they're solving that problem for? Have they identified that specific target market? So did they identify a problem being solved for a specific market and get feedback from customers that reflect that's true? So that's the first piece. Judges, questions? Do you need a screenshot or more time for notes on these judging criteria? Okay. So the next piece is execution and design. And so this is really about the team's ability to take action and execute over the course of the week. I know not every team had software developers, or some teams were really complicated biotech or life science ideas that you can't actually build in the course of the weekend or of the week. And so what you're looking for here with execution and design is, did they do anything to prototype what it could be like? Whether that's drawing it out, wireframing if it's software, mocking it up, understanding the value chain of the solution and putting that in front of people to get feedback on that. So anything that the team did to kind of prototype the experience that the product or solution could be like in the future. Putting up a web page is great as well. Anything that kind of points to the team executed and took action on this idea. That's the second piece. And the last piece is essentially, can this actually make sense as a business? Again, back to not only is it solving a problem, but in a way that people will pay for. Is there a value proposition there? And is it unique enough that it makes sense in the market versus other things that are already out there? So market validation, execution, and then can this actually make sense as a business? Any questions from the judges on those judging criteria? Okay, so how it will work is we've got 4 presentations. Each team will, one at a time, share their screen and take the floor for their presentations. They've got 5 minutes for the presentation itself. And this is 3 minutes for Q&A, but we've got a little wiggle room on time. So we may be able to expand that if judges have extra questions. So what will happen after all 4 teams go, it'll be rapid fire between all 4, is we'll send the judges to a deliberation breakout room to discuss their favorites for the winner and the first runner-up. And during that time, we'll have a guest speaker here for our participants. Questions about the process or what's happening? Judges will just have you unmute yourself and talk to the team directly when it's time for Q&A. Teams, feel free to chime in during Q&A, even if you weren't the one presenting. It's great to see kind of full team participation in that part of the presentation. Nate or Jenny, do you want to give the rundown of what we're competing for here at Startup Week Demo Day?
Yeah, absolutely. Thanks, Susan. So in addition to everything that you've learned and you've toiled and you've worked hard on, those things you cannot put a price on, obviously. But we do have 2 cash prizes for the winning teams. We have $800 for the grand prize, and we have $500 cash money for the first runner up.
Awesome. So it's all on the line. Okay, so this is the lineup of the pitch order teams. Hopefully you've already seen this. So this is the order that will go between presentations. And that's it. We are ready for our first team. So I will go ahead and stop sharing. And team.
Good morning. Hi, everyone.
There you go. Hey, Fiara, and I will give you a 2 and a 1 minute warning here, and I'll try to do it in the chat as well.
Perfect.
The
Thank
floor
you.
is yours.
All right. Is everyone able to see the screen?
Yes, looks great.
Okay. I'm just about, okay, there we go. Okay. All right. So good morning, everyone. My name is Fiara Laguno. My partner, Naveen Dewan, and I are thrilled to introduce our product, which will revolutionize and modernize the dermatology practice. This is Tracy, mom of 2 from North Carolina. A few years ago, Tracy noticed an unusual mole on her forearm. She contacted her healthcare provider, and the soonest appointment was in 4 months. It was that appointment when she was first diagnosed with melanoma. Tracy was lucky her cancer was still treatable, but for others, 4 months is long enough for the disease to progress to its severest form. Unfortunately, Tracy's story is just one of many. While the Bay Area boasts an abundance of healthcare resources, recent studies have shown that 69% of US counties have no dermatologists. 4 in 10 patients report waiting 1 to 6 months for a dermatology appointment, and 32 days is the average wait time for a derm appointment in the US, with this number escalating to 96 days in Cedar Rapids, Iowa. We contacted dermatology patients across the US and found that their top 3 values in derm treatment are the ability to ask real-time, non-urgent questions, a faster response time, and a more affordable option. Most also wanted a way to track their symptom and condition progression, or a way for the app to set reminders for their topical creams. Perhaps the most impressive feedback that we received was that 58% of customers wanted a way to contact their dermatologists via a mobile app. Whether it's physical distance or communication frequency, there's a critical need to improve accessibility of derm medicine in the United States. With the omnipotence of smartphones, we believe an app can best address our customer needs. This is Cutiescope, a multifunctional application that brings the skin specialist to the patient's hands. Here's how it works. First, the patient takes a photo guided by the app. The photo is then cross-checked to our vast database to assess for a wide variety of skin conditions. If the app determines the case is moderate, the photo will be logged into the patient's personal tracker, recommend over-the-counter medications, and provide dermatology contact information in case the condition persists or the patient wants to further consult. If it is severe, the photo is automatically sent to a dermatologist for verification. Cutiescope offers benefits for all major players. For patients, they have easier access to dermatology treatment, personal record logging, and more inclusive testing. Our AI algorithm standardizes skin analysis to provide high specificity and high sensitivity results for all complexions. For dermatologists, they have a much larger reach, able to reach customers that may live 30 miles away from their practice. They're also able to practice more efficient screening to focus on the most critical cases. Finally, for our health insurance providers, earlier detection simply means lower cost of treatment. Here is our demo. As you can see, we picked a simplistic, minimalistic design to provide easy use for all ages. The photo on the left is the landing page with all of our features, and the photo on the right is an example of our personal condition tracker. There are existing derm diagnosis apps on the market, but Cutiescope is a cut above all the rest. Cutiescope uniquely uses AI technology to assess likelihood of a wider variety of skin disorders than our competitors, providing a mediating checkpoint that saves patients the worry and physicians the time. This step also allows us to provide quality results at a more affordable cost. Our target market is adults ages 18 to 80 that live 30 miles or greater than 30 minutes away from their nearest dermatologist. Our largest competitor in AI derm applications has yet to flood the US market. Thus, our priority is to first tackle the US rural areas, then expand globally to underserved communities worldwide. Our revenue primarily comes from the registration and app purchases, additional features to come based on customer feedback, and ads and promotion from skincare and product stores and companies. Cutiescope is the next step in modernizing skincare, and our team is primed to make this product a reality. We come from biomedical engineering and business backgrounds and have years of experience in research, market strategy, and quality control. With Cutiescope, we are ready to help millions of people better understand their skin. We are excited for you to get your skin in the game and invest in Cutiescope, skin diagnosis in focus. Thank you for your time.
Excellent. Thank you. All right, judges, the floor is yours. So we'll start Q&A time.
All right, I'll jump in. Hey, Fiara, nice job. That really great. Nicely done.
Thank you.
Question, have you thought about how the doctors make money from your app? And if so, what's the revenue stream coming into the dermatologist?
Yes, we have. I'll answer that one. Thank you so much for the question. We have a thought about that. Our primary revenue stream will obviously be from the aforementioned sources. We have considered tie-ups between dermatologists and the insurance companies. Obviously, they have their own contracts with those dermatologists. So we expect that revenue would come that way. And we are open to other models in terms of direct, linking with dermatologists who would use our app as well.
Naveen, if I can step in really quick, I think another potential opportunity could also be in how or which dermatologists are promoted on the app. Since it is remote, any dermatologist is able to treat or to recommend or to consult with any patient. And so in the cases that I mentioned where it was perhaps more moderate and yet a patient still wanted to consult or to get a second or a professional opinion, maybe the order in which we recommend dermatologists could be influenced by how much money that the practice is willing to pay for that premium position on the app. So just an idea.
Cool, good.
Fiora and Naveen, this is Florence. Can you tell me a little bit more, talk to us a little bit about your methodology in selecting people to talk to from the different camps. Very impressive presentation, by the way. Good job.
Thank you. So Naveen actually is a medical student. And so I leveraged a lot of his knowledge. He also had some contacts within dermatology, dermatology residents specifically to us. In terms of getting customer feedback, I put together a quick survey on Google and I posted it on a ton of different Reddit related to psoriasis, atopic dermatitis, eczema, melanoma. So we were able to get points from Connecticut, points from Seattle. So it was really nice to be able to see everyone's responses. Though I do think that we may have not been able to target directly who we wanted, just because I think maybe Reddit is more commonly used by people in urban areas. But I was glad that we were able to get some feedback from people across the country. So gave us a good starting point.
Hi, thanks. I got a quick question. On your slide, you mentioned you have a vast database, and I was just curious, and I'm sure this hasn't been built yet, but what is the size of your database? What sort of database do you think you need to be able to make an accurate diagnosis?
Naveen, did you want to chime in or should I?
I'll allow you to answer that.
Well, I do think that for some of the more common ones, such as melanoma and acne, it would be we would be able to produce a larger number of those images. Just scouring Reddit, I did see a lot of people that were very comfortable posting anonymous photos of themselves, and I'm sure it may be possible for us to request the permission to use that for our database. In terms of an actual number, I am thinking that we would need maybe anywhere between like 2,500 or 5,000 like per condition. So whether it's psoriasis or melanoma, in order for us to start off at a really high comparable sensitivity and specificity to a dermatologist, which is roughly 97% on their end. I do hope in the long term, though, that these photos that are being submitted could also further contribute to our database so that we have a higher end value and can thus improve the accuracy of our tool.
Got it. Yeah, and just to clarify, it's fantastic to get, random shots of skin lesions, but they really have to be associated with a validated clinical diagnosis for each of those pictures, where a real a pathologist or a dermatologist has said, yes, this is atopic dermatitis, or yes, this is a squamous cell carcinoma, or yes, this is a psoriasis or something. But yeah, the other thing I was curious about, and especially since you just mentioned acne, why the cutoff at age 18? I know that's the difference between an adult that can do their own informed consent and a kid that can't. Is that the reason that you cut it off at 18? Because I would think that for parents whose kids get a weird rash and they're out in they're in the rural area, they're out in the rural area more than 30 miles from a dermatologist, that that could be an especially useful market, moms or dads taking pictures of their kids' rash. Thanks.
Thanks for the question, Charles. You're absolutely right. That's a great point. And that was precisely the reason we designated 18 years as a cutoff. Really, the pediatric population is defined as under 18. So we figure that, if we did market to 18 and up, hopefully we would also be hitting, the parents of those children. And so that was kind of the rationale behind that decision.
I'm thinking that the actual user of the app would have to be 18 or over, since we are anticipating that health insurances may be able to cover for the use of the app. But if there were a child with a specific skin lesion that needs to be observed, it would be the parent that is taking the photo and then contacting the dermatologist.
Got it.
Awesome. I'll chime in real quick. Great presentation, first of all, really easy to follow. I had a question following up from Charles' comment regarding, the database. Is the idea that the product will make diagnosis based on AI, or will a dermatologist actually look at the pictures and then send valuable feedback?
So our AI technology, our AI algorithm will do an initial assessment. However, because we have to keep in mind sort of the specificity and sensitivity of our algorithm, there will be a confirmatory, diagnosis made, or an extra look that a dermatologist, will make, particularly with the cases that pop up and are more concerning. So there will be that component, although it won't be for all of the cases. Our product is unique because we have this screening mechanism that a lot of the other apps don't.
Awesome. And then
sorry.
Go ahead, Fiara.
I just wanted to chime in a little bit. So our competitors have found that 70% of the photos submitted to them are non-critical cases. So they're moles, or they're completely normal. It's a non-threatening condition. And so as Naveen was saying, we're trying to be that mediator, be the one that filters maybe those 70% that are non-serious, so that the dermatologist can really focus and give their time to the more critical cases. And so the AI app, as Naveen said, would not make the diagnosis. If it is deemed serious, then it will directly be sent to a dermatologist. But if it is considered maybe moderate or mild, we'll also offer resources for them to contact if it does persist or it does worsen.
Awesome. And then real
All
quickly.
right, we can do, oh yeah, and we'll make this the last question.
I was just going to mention Curology has a similar business model as what you guys are proposing with acne and skin issues for the face. So that might be something to look into if you guys want to continue the project.
Thank you.
Great, thank you for the idea.
Excellent. Thank you, judges, for your questions. Thank you, Team Cutiescope. That was a great way to kick it off. Awesome work this week. All right, our next team, Team Opti. If you'll go ahead and share screen and get settled, you'll be up next. Whenever you're ready, I'll start the timer when you start presenting.
Hi, everyone. My name is Hannah. I've been a bedside emergency nurse for about the past 10 years. And my team and I would like to introduce you to Opti today. So do you remember that rash, or that you don't know where it came from, or that cough, or that weird ailment, and you went to your doctor for help? Remember how they spent more time looking at the computer and looking things up and ordering tests for you instead of actually looking at you, the patient? So we as medical professionals are we are professional puzzle solvers. We try and figure out and cure your ailments. Well, we're always going to need a computer to research things, order tests, labs, etc. What if there was a way to cut down on the time providers spent on the computer and increase looking at you, the patient? So why do we spend so much time on the computers as nurses and physicians? Well, look at the number of resources I could use to figure out your ailment. This is the real homepage from UCSF that I use on a daily basis. Our market research of physicians and nurses from across the country also experience the same issues with time-consuming researches and homepages that look like this. This homepage is great. It has so many vetted resources that UCSF pays for, but if you have time to spend looking for answers on each different platform and clicking on each different link. But as an ER nurse with a full waiting room and sick patients, I don't have time to look through each link. I need an answer quicker. So meet Opti. Opti is a streamlined search engine made for academic institutions that uses AI technology to pull information and articles from all of the links on that overwhelming previous page you just saw. As you can see here, each result is from a database that has a summary for easy reading and clicking. Drug libraries, research articles, manufacturer info, policies, procedures are all in one easy to find place. There's no more need to switch platforms and browsers to find an answer. It allows providers to spend more time with their patients and increasing patient safety. Opti will be a homepage as well as a phone app. Our long-term goal for Opti will be an electronic charting plugin. Our initial target market is large academic institutions that already have the different siloed resource platforms in place for their employees. There's over 400 in the country. Ultimately, Opti will expand to all hospital settings in both urban and rural environments to bring the best resources for patient care to all facilities. Not only does Opti ensure that facilities get more return on investment for the subscriptions they pay for, it will also reduce costs. UCSF alone spends about $4 billion on medical personnel costs annually. We estimate that about 20% of this time is spent on bedside administrative tasks, such as researching disease processes, interpreting lab values, determining the best treatment option for you, the patient. If we reduce this administrative burden from 20 to 5%, we estimate over $800 million annually in potential savings. In the future, Opti will be a subscription service, but to start, our initial revenue stream will be to take a percentage of the annual savings that hospitals save in bedside administrative costs from using Opti. This is a brief overview of our plan going forward. Our ask today is that you come with us on this journey to launch Opti to help fund and create our MVP. I am a bedside nurse. I know this problem of tedious access to information exists. I don't want to spend any more time researching multiple different platforms. So let's let Opti do the tedious work so all providers can spend more time with their patients, increase patient safety, and we can reduce costly hours. Thank you.
Hannah, this is Florence Lowe from Dallas. Have you, you said your first business model was to charge academic institutions for a percentage of their annual savings and administrative costs. Have
Yeah.
you talked to any potential clients to see what the what their reaction was? And great job on your presentation, by the way. Good job.
I did, due to the time constraints of this week, I did have emails and phone calls out to a bunch of higher ups at UCSF. I was able to talk to my managers within my department as well as a few other managers, and they said something like this would be helpful. So yes, but in terms of like higher ups of like decision makers, no, I wasn't able to.
Hey, so Hannah, how do you envision that it actually works? Meaning that different institutions will have different subscriptions to different resources, I assume. And so it'll have to be tailored for every institution with their own particular sets of resources?
It doesn't actually have to be tailored to each different institution, because each institution is already logged in and already subscribes to their policies, procedures, up to date, LexiComp, their drug libraries. So it would just optimize and like pull from all of those different libraries in one interface. It would be optimized, I guess, per like their policies and procedures, but it doesn't even have to. It would just pull from all of their existing interfaces.
Yep.
Hey, Hannah, Charles here. Can I follow up that question? Because I was thinking of something similarly, which is some of the sources you want to sort of become a clearinghouse for. I'm just thinking of things like the NCCN guidelines for deciding which medicine for a cancer patient.
Mm-hmm.
Will those companies really want you to be, how will you get access to those resources? Because those resources themselves are making money doing the exact same thing, although they do it directly as opposed to going through a clearinghouse of 20 or 30 of them. But how do you think you're going to get the permission of those information providers for you to be sort of a filter to them?
Great question. Because the facilities will already have their subscription, this will just be like an added, I'm still using all of, for example, UCSF's resources that they already pay for and are licensed to UCSF. So it would just pull from the existing UCSF database of subscription services.
Right, but you have to basically scrape, or you have to have permission to kind of go inside their database. You're basically going to be you're going to be typing in psoriasis or something into their database, and whatever they spit out will go to the user of Opti.
Correct. Yes. Then in terms of licensing, I don't totally have an answer for you yet. I don't know if Adam, if you have an answer.
Sure. The basic algorithm that we're creating is just going to comb whatever information is already available within the database system that's being accessed currently by the clinical staff, right? So we don't need permission to go into the back end of their programming in order to access the data. All we're providing is an overall infrastructure that not only can comb the data to pull out pertinent information, but part of the AI platform also will, so let's Google search disease X, right? Following disease X search, there are often secondary, tertiary things that have to be looked up to kind of bolster the entire understanding of the treatment, the different methodologies, the different techniques. So instead of having to type that into individual things, you can get the top hit, and then we give the 3 most commonly followed up aspects that need to be known for any given clinical staff in the procedure that they type into our search bar.
Great presentation, you guys. Oh, sorry, Charles, were you?
No. That I see that. Thank you very much.
Yeah, I had a question regarding the 20% statistics you had on your slides. Is that something that you got from your customer interviews? I think, Hannah, you mentioned that you have had a few phone calls out to faculty and staff. Who exactly did you interview, and how did you calculate that 20%?
This 20% was given off it was taken from the UCSF annual report. So yeah, again, I was unable to reach, I attempted to contact IT and higher up in administration, but they did not return my calls. So I went with the UCSF annual report.
Awesome. And then did you interview people who are at the front lines and nurses for the time savings aspect for the value proposition?
Yes, I interviewed all of the nurses in my department as well as residents and physicians. I also used my nursing network to do market research across the country. Seattle Children's, Boston Children's, and Texas Children's, and just used, I probably got in total about 40 to 50 conversations with people.
Great work.
Thank you.
All right, we can do 1 or 2 more judge questions if we have them. If not, that's okay too.
Susan, I'll ask a question if no one has
Yeah.
one. Hannah, great job talking to over 40 people, nurses, and I, as a layperson, I can tell you my observation has been that the systems that doctors, whether in clinics or in hospital settings, have very antiquated. I come from the technology field, SaaS, software, and that's why you have the kind of interface that you showed. So what you're trying to do, I really commend you on that. Have you thought a little bit about how you're going to solve the problem of the provider looking at the individual while researching the issue or ordering tests or what have you? Like, have you thought about, do you use voice? Do you use AR or VR to solve this, instead of having as a long-term goal connecting to EChart systems, right, which are themselves also have really bad UI and UX?
Great question. Yes, I've thought about a lot of our providers today use the dictation. So if there was some sort of wireless dictation that they could use, so they're not stopping.
Yes, and Alexa in the.
Oh, perfect. Yeah, I'm sure Alexa, we could incorporate Alexa into this business model. Absolutely. But essentially, yeah, wireless dictation to help them connect to the computer. That way, everything is already pulled up as they, when they return to the computer. So they don't have to take their eyes off the patient.
Sounds good. Thank you.
You're welcome. Great question. Thank you.
We can take 1 more question if we have one. Going once.
What would you charge for this?
What would I? That's Adam, do you want to take this question?
Sure. I think that the risk sharing model at the rollout is the right way to go, because we do save so much time potentially of clinicians working on the ground, right? Or any clinical staff, whether it be nurses, whether it be the actual physicians. But eventually, if we're looking at the total dollars that are saved just by the time and then the augmentation of the value prop to the direct patient, if we take 20% of that number, we're looking at, several $1 million on an annual basis for an entity to be able to take advantage of this. If they do in fact realize the value proposition that we're proposing as far as decreased time spent in research, increased time being able to spend with patients, and bring in more orders and see more people.
All right, thank you, Adam, and great job, Team Opti. Zoom round of applause. Great presentation. All right, up next is Team M3DX. Judges, I didn't give you a ton of time after the last one for note taking or whatever, so give me a thumbs down if you're not ready. Otherwise, I'll assume we're good. All right.
We should be ready to go.
All right, Tim, I think we are good to go. So I will start the timer when you start presenting.
All right, you can go ahead. Hello, everybody. Our company name is Hospital Molecular Multiplexing Tech. And our idea is to present an at-home hospital for the everyday user. So you can know before you need to know what your condition is. You can self-diagnose yourself in a very cheap manner. So our team here is mostly based out of UCSF. And from here, David will go forward.
So M3DX Corporation has a motto. We say, go big or go home, but the nose knows. And so in 5 minutes with $5, you can do a multiplex assay. For example, we have a triplex assay, SARS-CoV-2, that picks up all the variants as well as influenza A and B. And you can see this visually with your eyes at your desk, in your bathroom, in your car, for all your loved ones and your roommates and your family. And you can take a picture of it, and it can go also to the cloud and to your nurse practitioner or your physician's assistant or your physician. And then we can confirm the diagnosis, for example, the antigen of SARS-CoV-2 and influenza, and the nose knows. And so we are using nasal wash aspirate. And what's clear is that this is a multi-billion-dollar opportunity for at-home diagnostics. Also, we can move this to point of care. And it's a remarkable opportunity for mothers and fathers and people of all ages to take the molecular MomTech MXDX, the M3DX, for example, from a nasal wash aspirate. So here's an example of a mom taking a nasal wash aspirate. She's shooting saline into the nasal cavity. Out comes the saline, and in that saline is the, God forbid, SARS-CoV-2 influenza antigens. And you can see that on the right, where the SARS-CoV-2 will come out in C and influenza A or influenza B. So this unfortunate child has influenza A and SARS-CoV-2. And so the focus is to meet this unmet medical need for at-home visual 5-minute, less than $5 multiple molecular antigen and RNA tests for infection, as well as monitoring temperature or redness for inflammation. So we have proof of concept for a molecular antigen test using lateral flow immunoassay. And you're all familiar, of course, with the pregnancy test that uses an antibody to pick up an antigen, and we can pick up the antigen or we can pick up the RNA. We have class 2 software, we have the lateral flow immunoassay, and we're moving this nicely to the graphene chip immunoassay as a medical device. We'll bring this to the FDA. We can get reimbursement from CMS once we do the confirmation. The temperature, the redness, the inflammation, as well as the immunodiagnostic analysis of the antigens and the RNAs is all based on antibodies in lateral flow or graphene chip immunoassays. It's faster, cheaper, more effective. You can get multiplex visual readouts with no target RNA amplification, no $25,000 PCR machine, no expensive reagents. We're using immunoassay here with signal amplification, not target amplification, for example, for the RNA. So proteomic, genomic analysis, the criteria for evaluating the mom hospital. So we do have biovalidation. We have remarkable team, Enrique, Tim, Shantali, Kuval. We have serial entrepreneurs. We have Tim as an electrical engineer, spearheading the molecular assays, all done on a graphene chip. We can now show that the nasopharyngeal aspirate, much more sensitive and accurate than the gold standard, the nasopharyngeal swab, which is unpleasant, can be very painful. And we're also able to pick up sweat as well as other bodily fluids, including sputum, saliva, urine, poop, you name it. Next slide, please. So we validated this business model. We've got really good, strong ability to execute and design. Our execution will be flawless here. We're incorporating customer feedback into the solution. We've talked to a dozen home users. We've talked to dozens of point of care users. This is a solution. And Shantali, are you with us? Can you take us through the customers surveyed or?
Yeah, Shantali is not here, but I can briefly explain the slide. This was a
go ahead.
survey that we conducted based off asking people where they would want a self-diagnosis device. So most of people would want them on their wrist. And what we found is that if sweat analysis were a feature, which it is not currently, then we would be able to test for a wide variety of diseases as well as conditions, and then sync that to an Apple Watch and create a large database based off where people can look at their conditions, send them to their healthcare provider, and such a database would have a lot of value in itself.
All right, Tim and David, you guys are out of time, so wrap it up. You have 10 or 15 more seconds.
Yeah, so in the last 10 seconds, we're on a roll, go big or go home. This is a huge market. We're there. We're going to build a multi-billion-dollar public company based on this whole concept.
So if I can get to the last slides here, this is how the nasal wash aspirate works. But the last thing, if we're out of time, wanted to get to the budget, how we would finance this. Our model would be a subscription model where we would charge $100 a month to provide somebody with the device, as well as basically an infinite amount of samples to test with. And this is including patents, full-time engineers working on it, as well as the cost of the raw materials for the lateral flow immunoassays and chips as well. And we know that the smartwatch market is.
We need to move into Q&A. Sorry, guys, but I can't give you too much more time than the other teams. So judges, we'll let you take it from here.
Okay, so David, what's the innovation here? Is it the graphene chip with the lateral flow assay on it, or is
the
it
marriage between the nasal wash aspirate and the lateral flow assay, the marriage between the nasal wash aspirate and the graphene chip, moving the immunoassay to a 5-minute, $5 test that's got a visual readout that's multiplexable and that all goes to the cloud. That's the innovation. The ability to move these multiplex diagnostics, not only for infectious disease, inflammation, metabolic disease, early cancer detection, is a very innovative vertical.
Okay, great. So why haven't people done this before? Is there some technical hurdle?
Yeah, why didn't you invent the hula hoop? It was all there. I mean, its timing is everything. Look, this pandemic that is with these infectious bacteria and viruses and fungi, and now the opiate epidemic that is 1,000-fold increased, the epidemic of diabetes, obesity, the epidemic of cancer, all of these things have hit the hospital. And now we can do this at home every day for less than $5, and we can get reimbursement for this as we get these samples confirmed, and we can do the deep immune profiling, the innate immunity, the adaptive immunity. The time is ripe. Timing is everything, and we are going to hit this market hard.
All right, great, thanks.
Yeah, quick question. Focusing on COVID-19 and influenza A, I see that. But, if there's a typical kid and then the typical mom wants to look at her, do the nasal wash. I mean, there's all kinds of other, rhinoviruses and adenoviruses and RSV and all these other common cold viruses that are much more likely to be underlying the kids' symptoms.
Charles, you're right on.
Rather than COVID or the flu. So
that's right. You're right on. The multiplexing, So we can pick up not only SARS-CoV-2 and flu, but also RSV, we can see the bacteria, we can see the fungal infections, we can see all of these pathogens. We can multiplex. Our system allows us to do massive multiplexing with visual readout, with optical reporters where we can see a different color for each pathogen, for example. Excellent question.
Right, but when you think about the pregnancy test that was mentioned, I mean, that there you're measuring, one metabolite, one entity. How is lateral flow or the graphene thing you mentioned?
We have optical reporters that will pick up hundreds of molecular markers at once because you can see the different colors.
Got it.
So David, Tim, and Timur,
And Shantali and Kuval.
and Shantali, and yes, so I'm, I'm not a scientist, so I'll leave the science aside, but why are you pursuing a SaaS, or not soft, I guess, medicine testing as a service, SaaS, a subscription model? I'm the mother of a 12-year-old boy, and he actually wasn't a sickly child, but as a parent, I don't see myself paying $100 for a product.
That's a month. That's a month. So
correct, a month for a product.
And that's for an unlimited amount of tests where we've adopted the Abbott model of reagent rental. For $100 a month, you get unlimited amount of these $5 tests for you, your family. And so these are delivered to you. And so you can get testing every time you come back from the store, every time
David, I understand the model. My question is, have you talked to a lot of both, consumers like me and maybe explored other parts of the market that might be quicker to, to pull their wallet out? A B2C play, business to consumer play, is very hard, right? It's a very different market from a B2B play. What kind of research have you done to talk to consumers' potential to understand the market?
Okay, so we've talked to the DoD, we've talked to BARDA, we've talked to DARPA, we've talked to dozens of consumers. We are convinced that our data shows us that we are correct. Period.
All right, judges, we can do one more question.
I got a question. So David, it seems like your product can do a lot of things. It can, analyze a lot of biomarkers. It can test using different ways. For your target market, it's probably not going to be the case where you can do everything all at once. So what's your target market? What's your
So temperature, redness, and the flu A, flu B, and the SARS-CoV-2, those are the big four. Temperature, redness, and we can pick up these very important pathogens like the SARS-CoV-2 variants of concern and the influenza A and B. That'll be our target. That'll be our entree. We'll drive millions of dollars worth of revenues, and then we'll scale it from there. And then we'll move in parallel fashion with Tim and the whole engineering team. We'll move from lateral flow immunoassay to the graphene chip immunoassay using the same reagents. And we will dominate that market because we will be the first in that market. And we have the IP and the team and the business model and hopefully the investors to drive this.
Yeah, if I can add something to that. So our target market initially would be smartwatch users, because this would be paired with people using their smartwatch. Most people would want their diagnostics device to be held on the wrist. Also, another target market is, we want to start out in the United States, but potentially branch out to South America, where COVID-19 variants are running rampant. So we think that people will want to be able to diagnose themselves if we produce a alternative that measured for different kinds of COVID as well.
All right, thanks, David and Tim. Great job, team M3DX. Thanks, judges, for the great questions. And we will move on to our final presentation. So, team Telehuman, you guys are up. Jessica, feel free to go ahead and share your screen, and I will start the timer when you start presenting.
All right, can everyone see my screen now? Great. Hi, we are Telehuman, and we are looking to reintroduce a human connection into telehealth. Imagine for me a second that you can't understand what I'm saying. That's not a big deal right now. It'd be a huge loss for the millions of potential customers we'll have, but not a big deal for us right now. But what if I was your physician? What if I was giving you your lab results or a family member surgery outcome? It would be crucial that you understood accurately and thoroughly everything I'm saying. That is a struggle that many non-native English speakers have difficulty with during telehealth Zoom appointments. And right now, telehealth appointments are more popular than ever because of the pandemic. Communication failures like this have led to patient injury in over 7,000 cases across 4 years. Of these, 37% of high severity injury cases cite communication failure as one of the causes. And this all accumulates in over $1.7 billion in total losses incurred. We want to mitigate these costs and ensure equitable treatment for everyone, including the 60 million Americans who don't speak English at home, as well as the millions of international travelers that visit the US every year, most of whom come from countries where English is not the native language. With just these two populations, we have a total of over 100 million potential customers. In just this 1 week, our team has interviewed about 30 of these potential customers, and here's how we'll solve their concerns. Concern number one is that most of the middle-aged non-native English speakers mention not understanding the medical vocabulary that their doctors use during appointments. With Telehuman, they'll be able to receive a translation of those medical terminologies so that they can better follow along and ask relevant questions during the appointment with their physician. Concern number two, some caregivers at an assisted living facility mention not understanding or having doubts about understanding the follow-up instructions provided by doctors. We'll be able to provide translations of the key parts of their follow-up instructions to make sure that they understand how to best perform their follow-up care. And lastly, concern number three, some students who do use existing captioning software have told us that this software doesn't translate medication names well or can translate it inaccurately. With Telehuman, they'll be able to receive a written version of this word so they can better know what they'll be receiving and better ask questions about dosage, usage, and medication type. With the increase in telehealth appointments, there's been a lot of advances in this field, including companies that provide translation for written medical documents, companies that provide audio, visual, and in-person medical translation. But even relevant companies can charge as much as $880 for just 30 minutes on Zoom. Here's the Telehuman advantage. We have no cost to the patient or physician, no scheduling issues or wasted time waiting for an interpreter to connect. We integrate into existing platforms for convenience of use, and we provide real-time dedicated medical translation to create a convenient, affordable, and fundamentally human experience. Our revenue will come from healthcare providers such as hospital networks, clinics, and universities with student health centers, as well as video conferencing platforms such as Zoom and Teledoc that want to improve the experience for customers that are already using their product for telehealth. Our short-term target market will be the 1 million international students in the US every year, most of whom come from countries where English is not the native language. Among these, 6,800 are at Berkeley, and we would like to start with a campus trial at Berkeley. Teledoc is our current telemedicine partner providing telehealth appointments for students, but they only offer phone translations. With Telehuman, we will empower these students to take confidence in their own health and well-being. Our team consists of students and young professionals with extensive experience in clinical trials, or clinical practice, and translational medicine. But hopefully with your connections and advice, we can add programmers and full stack developers to help us realize the vision of Telehuman to reintroduce a human connection into telehealth. Thank you for your time.
Great, thank you, Jessica. Judges, floor is yours.
Jessica, great job. I think it sounds like I think you've identified a problem. I think you can extend it to people not speaking English in the US is one thing, but not speaking a language wherever they are is, so it could be anywhere in the world. But so I'm a little confused about what the product is. What is the product? Is it a service, or is it AI technology and database that you're creating that has an API that can plug into Zoom or Teledoc? Can you explain the product a little bit more?
Sure. It will function as either an add-in or some sort of an API that works with Zoom and other video conferencing platforms to provide the functionalities that we described. We don't know what it'll actually look like right now, but given the wealth of possibilities, we'll look into whatever would best fit the functionality we're looking for, as well as can best integrate into the platforms that exist now.
Hey, Jessica, so I understand your source of revenue you anticipate to be healthcare providers and the video conferencing platforms, which I take to not mean like Zoom, but like Teledoc, right? Yeah. So what's in it for them? Why do they pay you?
Sure. So this service will be easier than for hospital networks that currently pay for over the phone or in-person translations. This will be easier on them for scheduling, in terms of scheduling, as well as in terms of pricing. And for Zoom and other video platforms that are already HIPAA compliant, and therefore they know that their customers are using their products for telehealth appointments, this will improve the experience for their customers and hopefully encourage more customers to go to their sites through our service.
Hey, Jessica, I'm curious to know, in your customer interviews, were you interviewing mostly people who had the language barrier? Did you by chance interview doctors or healthcare professionals who were on the other side and trying to communicate with the patients and see how they felt about the situation?
We interviewed a lot of patients that have been having these difficulties with language barriers during telehealth appointments, in addition to some, not quite physicians, but medical students that have also experienced similar concerns during their rotations or their practices with patients during their coursework. So we took both of those sides of feedback into our customer discovery and to help us better refine our final product or our mockup.
Hey, Jessica, thanks. I was wondering, you mentioned the 6,800 international students at UC Berkeley. I'm just guessing that they speak 50 different languages or more. And I can see how you want to start. You'd likely start with something like, with languages like Chinese or Spanish or Tagalog, or these much more common other languages, foreign languages than English. I was just wondering, do you think that companies like Siri or Alexa, those other companies that have the voice recognition software, they must be trying to create the voice recognition for all kinds of really obscure languages. So you think there's any chance you may be able to take advantage of what they're already doing to convert some rare Indian or Slavic or Asian language to English?
Absolutely.
And vice
Speech to
versa.
language.
Sorry, vice versa too.
Sure. Yeah, speech to language or speech to text, excuse me, is a really important field and that has had a lot of technological advancements lately. But we want to utilize not only that technology, but apply it directly to medical translation. So a lot of the issues that we've noticed with speech to text is that it fails when it comes to lengthy medical words or very technical medical terms. And for a lot of students, they are comfortable speaking conversationally in English or in their non-native language. But when it comes to medical terminology, where the stakes are so high, in addition to the word, the vocabulary level being so difficult, we want to help rectify that issue and fill in that gap for those students.
Oh, I see. Yeah, that's clever. Thanks.
You could even extend it to anything that's technical, right? It could be legal terminology for immigrants and refugees, or something that is very, very esoteric.
Yeah, one of our long-term visions is hopefully to be able to apply this type of platform and this type of interaction service to perhaps research, or like you said, to legal proceedings as well.
All right, I think we can take one more judge question if we have it.
Have you thought about what you would charge the healthcare providers and the API for video platforms?
Sure. We know that we would probably go with a subscription type model where there's a set cost per time. We don't know what a range for that cost would be, since we don't know what our costs are to develop this product and also implement it into the markets that exist.
Okay, thank you, Jessica. Great job. And shout out to everyone. So, my congratulations screen shared. Congrats, you did it. Yes, everyone act like Nate and give yourselves a big round of applause. Thank you so much to the judges for asking some really stellar questions. I love it. You guys just dove right in. Great presentations to all teams. You guys came a really long way since what I saw yesterday. Okay, so with that, we are going to send the judges to a breakout room. And in the meantime, we have a really exciting guest speaker here. There's John. I just saw him pop on video to chat with you guys while the judges deliberate. So John is a co-founder at Shimmer, has agreed to spend some time with you guys today. And I don't know if Jenny or Nate have specific things for him to talk about, but excited to just kind of hear more of the story. So with that, Nate, anything to add? I see you on mute.
Yes, before Jenny does the full introduction, judges, I'm sending you to a breakout room with Susan now. Everybody else, please stay here. And we're excited for John's keynote address. So Jenny, to you.
Yeah, no, thank you, John, for coming here. Just to let you know, John has been part of our Launchpad, and he is a UCSF medical student here and has been able to take advantage of some of the other programming that our Launchpad offers, including our fellowship that we have each year, which is an 8-week program, and it comes with $5,000 grant money as well. So, but anyway, I'll let John introduce himself, and it'll be really, a great opportunity to hear his story about how he founded Shimmer and his journey to get it to where it is now. So John, take it away.
Thanks, and really thankful for the opportunity to be here and see you guys again too. Let me share my screen. I have some slides. Can you guys hear or see the screen? Cool. Great. So yeah, I'm going to be talking about kind of like my journey to Shimmer, and then a couple of things that I really think are important for after, like once you do start working on your venture, and like things to think about like in the beginning stages of it. But yeah, so I'm John. I'm a medical student at UCSF, and I'm going to talk about like just like the journey to getting here and being here today. So yeah, talking about the journey, finding your thing, which I think is really important to me, like figuring out exactly what I want to do with my life, and then the importance of personal company values and how to like go about doing that. And then lastly, like kind of like a little glimpse into life in a startup, and like some like kind of like words of wisdom that I wish I had told myself in the past. So yeah, so the journey to Shimmer has been a really bumpy one, and I never really thought I would be at this doing a startup in my third year of medical school, and it's been very tipsy and turvy, I guess, and but I've just been very thankful for every step along the way. So I'm actually from Minnesota, and that's kind of where I grew up. And I first kind of got interested in like science and also a lot of like social impact type work. After basically I got my fingers stuck in a snowblower, and it was a terrible experience for me. I had um, basically been playing piano for the past like 10 years at the time, and I had to stop playing piano. And it was like in middle school, and like a lot of kids would like kind of like make fun of me for having these fingers that for sticking my fingers in a snow blower, I guess. And it was really rough for me. And that, I think, was the first moment in my life where I had this like almost like existential thought about like what the purpose of life was, almost like why. Like I realized that like the pain that I was experiencing also in the grand scheme of other people's experiences wasn't actually that severe, but like I felt it so strongly and deeply. And I wanted to like start devoting myself to like not just like learning science, but also like thinking about like, how can I apply science to actually like helping other people. Um, and I was just was really lucky to end up at Stanford, and at Stanford had a lot of awesome opportunities to work in hospice and really solidify like my passion for healthcare and making a difference in that field, as well as like becoming just more intellectually interested in technology. Had the opportunity to intern at Apple on their AI and data science team, and that was really cool in itself. And then lastly ended up at UCSF, and I thought I wanted to like really pursue medicine to its fullest and like become a doctor. But things happened, and I ended up Shimmer, and I'm going to talk more about that transition as well, which was a really big one for me. But yeah, so I'm going to go into like a couple of just short highlights of each of these things. So at Stanford, I actually really felt like at first I was like, oh my God, I'm going to be in this really amazing place, and I'm going to, basically like not succeed. And really was worried. I had like imposter syndrome at the time, and like, but I'm really thankful because I think I gained 3 really big important things that I've taken with me throughout my life. One of them is like service journey. Like I started volunteering in hospice at that time, and it was one of the most like impactful experiences for me to work with like individuals and helping them like um, just like honestly sitting there and talking with them and like seeing and feeling the emotions that they were experiencing, I think was really important. It like helped me think a lot about like why was I more about that train of thought, like why was I here, like what do I care about and what do I value. And secondly, like I would say it gave me a lot of confidence. So I mean, I was growing up in Minnesota. I hadn't really been exposed to people outside of like my community. And Stanford was an opportunity, and just the Bay Area in general, to meet a lot of diverse people and experiences, and like kind of like almost like subject myself to them and like talk to people that I would never have talked to otherwise, and like kind of show who I am to other people and like feel more confident about who I am as a person. And I think that was really essential in me feeling like I can actually like do things on my own and like pursue like what I really care about. And lastly, I would say like, yeah, there's just so many amazing classes at Stanford, and I really developed a passion for learning. And that's a very large part of the reason why I wanted to pursue medicine. Um, and yeah, at UCSF, there were so many things that I loved about UCSF, especially the people, my classmates. They're really amazing, stellar people who care so much about like improving human health. And they've inspired me. They inspired me so much, and they still inspire me a lot today. I live with some of them too, and I'm really thankful for that. But I would say that UCSF also opened a lot of doors for me to think about things outside of just medicine. Um, there's actually something called like the student halo effect that people talk about, where if you're a medical student or like any graduate or undergraduate student, people are more willing to like talk to you about ideas or talk to you about um, or help you too and progress and thinking about ideas just because you're a student. It feels like you're not like out there to like just like profit off everything that they're helping you with. But because you're a student, your job is to learn, and that's like a really cool position to be in. Another thing is that there's like a really amazing network of clinicians that you can tap into. So for me, like during the beginning phases of Shimmer, we actually interviewed over 50 different UCSF faculty in the psychiatry and psychotherapy spaces. And we got to meet like world's leading experts in research and group therapy, and also like even just talk to psychiatrists who are practicing and actually treating patients. It was really an amazing opportunity that it is incredibly difficult to access if you were not a medical student or a clinical student in general. And that was a huge part of how we landed on our current idea. But yeah, it was really cool. And yeah, at UCSF, I got to, I had the honor of seeing patients and like experiencing what it's like to be in a hospital. And there's so many things about that helped me think more about like what I like to do, what I want to do, and kind of keep pushing that thought process forward. And lastly, I would say, yeah, all these things combined kind of give you a really interesting like play box or space to explore. Because as a student, like really your job is to, like students have this unique position where they can like, their job is almost, yeah, it's just to learn and explore. It's not, so when you have like a full-time job, suddenly you become like a tool that someone has that you have to work and you have to do things like, even as a full-time clinician, like you have to see patients every day, and there's like a lot more things to do at every single moment. But as a student, you have like a lot of almost like free space in your brain to like explore ideas. Like that's almost like part of your job is to like think about like what's next in medicine, like what's going to be next in your field, because everyone else is kind of at that point already kind of like settled into their roles and are like pushing things forward at that pace. But like you have the opportunity to really think about things that don't exist today and like contribute in that way. To get to Shimmer. So we actually went through a lot of like the I-Corps. We went through I-Corps, we went through like the Blackstone programming, and we went through like something called the XX, which was like a accelerator program. And then now we're actually we're actually working with Y Combinator, and that's been a really amazing experience. Though that's technically supposed to be off the record, so don't share that with anyone yet. But yeah, the whole experience, we did the need finding, like the I-Corps and like the methodology there is like exactly like perfect. Like, yeah, you need to like really understand like whether or not there's actually a sustainable like business model, but also like, is there actually a real need for whatever you're working on, and just doing a ton of interviewing and like rapidly iterating on your ideas. But I'm like really happy with what we've kind of like landed on, which is the problem of the accessibility and affordability of mental health services in general, as well as like a supply constrained market where 50 million Americans with mental health issues, but only 100,000 therapists. And so for us, what we do, Shimmer does mental health support groups led by coaches online. So members are matched into groups with similar identities and experiences, and it's a subscription service that they pay for every month. And they meet every single week with their coach through a video session, and all on our like kind of community platform where they can gratitude journal and mood track and talk via like different voice and video channels. So it's been like almost a year since we started, and we're finally starting to pick up pace, and it's really cool to like just have gone through so much so fast. And there's so many differences from startup life from student life. And I just kind of wanted to talk about that a little bit too. Like you're really in the startup life, I feel like you're creating things that didn't exist before. And with that, there's huge amounts of uncertainty, while in school, you're learning things that already exist. And there's a lot of certainty in terms of where you're heading. So like, for example, while I was in medical school, like literally basically the next 2-3 years of my life were planned out for sure. Like I'd at least be in school, but even after that, there's like one decision I have to make, like what residency specialty do I want to do? But with startups, there's literally like every single day, there's like 5 decisions and there's not enough data for me to actually make the perfect decision. And you just have to like go with one and just hope that it's the right one. That's how it is a lot of the time. And there's a huge rapid pace of change and iteration that happens with that. And yeah, a lot of your identity, like there is a lot of identity, I think, that's tied to being a student at a medical school. But when you're a founder, like your identity really gets tied with the company. And in some ways, like, yeah, it's in some ways it's really cool because you get to meet a lot of other founders, but also in some ways it's kind of scary because sometimes it feels like if your company fails, then you also fail. And that feeling and that pressure, I think, is a really unique one that honestly, I think in some ways is similar to being a student, since it's like if you don't graduate, then like people always focus on the outcomes, I guess, almost. But with the companies, especially, I think prevalent because you have employees that you have to talk to and manage and help succeed in their lives as well. And if your company doesn't succeed, there's not just you online, there's a lot of other people online too. But yeah, so it's a little bit about Shimmer. And I know we're running a bit out of time, but I'll just quickly, briefly go through some like basic thing that I think is really important in the beginning. If you have co-founders or even just personally yourself, I think it's like making sure that you're working on the thing that you actually care about. So it's something that the world needs, something that you're great at, something that you can actually get paid for. And then lastly, I think the top one is the one that I like talking about the most. It's like something that you love. So it's something that matches your mission or your values, as well as something that you can do on the daily. So the flow state, like every single day I'm in flow, I'm really enjoying what I'm doing. So I'm going to talk about a little bit mission, not flow state, just because I think flow state is a little bit more self-explanatory to figure out. But with mission, there's 2 things. There's like your personal and then there's the company values. So there's something called value cards, which I highly recommend people like looking through and like figuring out exactly for yourself, like what your personal and company values are. Like for me, like my personal values are like service impact, learning, rationality, compassion, contribution. These are things that I really care deeply about and like resonate with so deeply. And I think it's important to align with that for yourself and also with your co-founders. And because it really, when you guys have different personal values, you need to at least know that you have different personal values. So then when you talk about or make decisions, you don't come into like conflicts. It's easier to figure out what the conflict is about if you like know it's a misalignment on personal values. And with those, you can work together to figure out what your company values are. Like, and people have different things. Like for some people, it's like they want their company to like become huge and like make a ton of money, and that's like honestly that is a valid like goal. And some people like care about visibility, like a lot of people looking at what they're working on, or a lot of people touching the product. And for us, it's for me actually, this is kind of like what I see as my company succeeding is that we're helping a lot of people, and our team is amazing. We're empowering a lot of people who care about mental health to like actually have a job and like work towards the mission that we believe in. And then lastly, like for me, I do care about like financial security and like that I have like some like actual like potential to live a life in SF. But like stuff like that, I think it's really important to like align with your like team on, and it comes up a lot if you don't do it ahead of time. And then lastly, I just want to give a quick message just about like this really helps me. This type of thinking is that like on the left you see this like straight line. That's how everyone thinks your career should be, and like everyone tries to like optimize for this straight line of becoming achieving the goal that you always wanted. But in reality, no matter what you do, it's always going to be curvy. It's always going to be like the one on the right. And I think that it's easy to say that, of course, it's like the classic enjoy the journey or whatever, but like it's really true. And like I think especially in startups when there's so much uncertainty and like 98% of startups fail, you have to have that mentality that like, I'm going to learn so much. Like I think startups is like one of the highest like learning rate per day, I guess, of a lot of different things that you could do. Like I learn a lot of things every single day. And I think, when you approach it with that mentality that like no matter what happens, I'm going to learn a lot, I'm going to grow a lot, and I'm going to be a better person. And in the future, because of that, things are going to be even better for me. I think that's like a really good mentality to have, because not only is life like that squiggly line, but like your startup is also going to be like that squiggly line. Like there's going to be a lot of ups and downs throughout the journey, and have fun, try new things, and always stick to your values. I think that's been something that has really helped me in like feeling fulfilled by what I'm doing, and especially in an extremely stressful environment. But also like making sure that I'm like pursuing I found my thing, and like I'm pursuing the thing that I really want to do, spend my a lot of my life working on. So yeah. So just want to thank everyone for listening to my talk. It's like my first time doing a keynote, I guess. If anyone has any questions, and we're also offering like a 40% off code for anyone who attended this talk today too. So thanks.
Awesome. Thank you so much, John, for sharing your story. I definitely highly recommend any questions for him. I mean, he's been through what you've been through, starting off, with just trying to define the problem and then how you find the solution. So he's been in your shoes.
I have a question. Great talk. Thank you so much. When did you decide, I know you're still in medical school, when did you decide to fully pivot with Shimmer?
Yeah, so I'm actually on leave of absence, which means I'm like working full time on Shimmer. But yeah, that's a really good question. I think there were a combination of things that felt right. I think one of them is the founding team that we were working with. I think it felt like we could work really well together. We were very aligned on our mission, our values, and our working styles were very complementary. We didn't have like the same domain that we butted heads in all the time. Team was really important. Honestly, I think there's like three things. It's like market traction, team. Those are the three things that I think people usually talk about when they make decisions in terms of where their startup's at. So if you have a good team, that's like a really big signal. I think a market, so you understand the market and that people actually want what you're building, and it actually makes sense in terms of like if there's like some future potential in your startup. And the traction being like, okay, we're starting to get some inbounds, and it's becoming to the point where I need to like think about this fully, or we're not actually going to be able to succeed. Like there comes a point in your startup where I think there's just too much work to be done to be a student and running a full-time startup. And it becomes this point where you're literally like thinking about your startup much more than your school. And I think for me, that was when I was like, okay, yeah, I'm basically like not even doing school anymore. There's no point in me like doing school at this point, because I care much more about this, and there's a lot more to be done right now and a lot more for me to learn. I think that was kind of my decision-making process. And like the fundamental base, like the people I'd be working with was good. And I could see a lot of opportunities for us moving forward in the market as well, because we've done our research already. So that's kind of some things that I did to like de-risk, I guess, the investment of my time and like going full time on that. But for everyone else, they have their own like, threshold, I guess. So figuring that out for yourself is probably the hardest part about it.
Awesome. Thank you so much. Good luck.
Thanks.
I had a question. Thank you for talking about such a variety of topics in relation to creating a startup. How do you recognize when your personal values change, and how would you reconcile that if they conflict with a team member's?
Mm-hmm. It's a good question. I think personal values changing, I've noticed actually myself, like I think being exposed to different environments and people often does influence my own personal values. And I've noticed that has changed being in the startup. I think that process itself of understanding your personal values and whether or not they're changing, I think that's something that requires like reflection, and I'm not exactly sure if there's like a process to it that you can like make sure that you're like knowing it, but yeah, that's a hard question. I mean, I want to say like, oh, spend like 30 minutes a week thinking about your personal values, but like, I don't know, for everyone it's different, I think. But then for the conflicts thing, I think oftentimes labeling it first. So like, hey, this problem is stemming from like a conflict in personal values. I think identifying the problem, the diagnosing part, oftentimes is the hardest part. So like sometimes it's just like personality conflicts, like it's not how we have different working styles and stuff like that. But like if identifying that it is actually like a difference in personal values, and then like I think there needs to be a willingness on both ends to actually like come to a solution or like some sort of like resolution based on this. So like we both really care about the company and the mission, and like we just have a difference in values on this point. How can we work together to like what plan can we come up with that's fair to both sides? Something like that is probably how I would go about it, and that's generally how we do it at our company. Yeah.
Thank you. I know it was a really open-ended question, but I appreciate hearing your perspective on that.
Any other questions before we give John a big round of applause? Great. John, thank you so much. Very, very compelling story. We appreciate all you're doing. And thank you for being here with us today and sharing your story.
Yeah, thanks for having me. It was a lot of fun, and it's great to see other like student entrepreneurs like working on these are like really awesome projects. So yeah.
Great, thank you. Susan, do you have the slides?
Yep. All right, I think we have one final thing before winning team announcement. Not another keynote, but a special guest here to talk to you guys a little bit about the Bay Area NSF I-Corps program. Jenny or Nate, any extra intro you guys want to provide for David?
No, I'll just say I worked with David and Rhonda over at the Bay Area NSF I-Corps. I actually sat in it recently, so great program. I'm excited he can tell you more about it.
Hey, thank you so much, Jenny, Susan, and everyone. Great to see you, Jenny, and so many other familiar faces here. Yeah, as mentioned, my name's Dave, and I direct the Bay Area NSF I-Corps program, which is a program really for teams just like so many of you, very early stage startups who come from UCSF, Stanford, and UC Berkeley, who have a new technology they're looking to commercialize. John from Shimmer is actually one of our alums. I got to know him, so it was really cool to see him speak today. And John, thank you so much for sharing that. And so great and not surprising at all to see you continuing on to make a big impact. As John actually quickly mentioned in his talk, he mentioned he did I-Corps, and the focus of I-Corps is squarely on the customer discovery process, which is in many ways just going to be a curated sort of structured continuation of what you've all sort of accomplished and learned over the past week, and a structured way to help you navigate that squiggly line that John spoke about. So in I-Corps, you'll conduct 15 customer feedback interviews during a 1-week program that will really help you to validate and know who your customer segments are, validate your value props, and really start to define your product market fit. then and only then, once you have knowledge of those and have validated those with confidence, can you move on to those other exciting next steps in growing your company, which is, starting to invest those significant resources, time, money, et cetera, into actually building out your product and going to market. So as mentioned, I-Core is a 1-week program. So it's really a sprint. We have 3 sessions from 6 to 9 p.m. during the evenings, and we run new cohorts every single month. The course is taught by instructors. Actually, Darren Cook is one of them. Great to see you, Darren, as well. All our instructors are from Haas at UC Berkeley. They're fantastic. They're seasoned entrepreneurs. They have a lot of successful startup experience, and they can help you to do the same. So you'll be getting feedback, guidance, mentorship every step along the way as you go. Teams who successfully complete Bay Area I-Core can also potentially go on to the National NSF I-Core program, which is 7 weeks long. You'll do 100 customer feedback interviews, and it also comes with a $50,000 customer discovery grant, non-dilutive, from the National Science Foundation, which is a pretty sweet deal. So our next course runs from August 16th to the 23rd. Applications are open until Friday. So if anything that I've shared resonates with you or sounds like it could help with your next steps, I'll definitely encourage you to apply. I'll share our website in the chat, which has our application. I'll also share my email. So if any of you have any questions as you go, please do reach out to me. I'd love to help early stage startups to achieve their goals and their dreams. And last thing I'll share is there's no cost whatsoever to being part of I-Core. It's just another resource for university teams and early stage startups coming from the university to really just accelerate your growth and make a big impact on the world. So that is it. I'll pass it back to you, Jenny.
I can take it. Awesome. Thank you so much, Dave. I 100% love the I-Core model, and I think it's even more meaningful right now when these teams are thinking about what do I do next to continue to validate that. So participants, if you have any interest in this, I would strongly encourage you to do it. You'll learn more in 1 week than you ever could, I think, without this kind of structured program. So do it. Okay, so after some tight deliberation in the judges breakout room, we are very excited to announce the runner-up and the winner of the HealthTech Startup Week event. So we're gonna get excited. The moment you've all been waiting for, it's finally here. So what we're gonna do is we'll announce the runner-up, and then I've asked one of the judges to say a few words about why that team ended up in second place, and then we'll announce the winner. And then one of the judges will say a few words about, why that team floated to the top. So to give you guys some active real world feedback as we go. So we'll announce the winning teams. And then if you guys will stay on just for another couple minutes, want to introduce you to just a few more community resources that are available to you as you keep moving forward, in addition to the I-Core program that Dave talked about. So if I can get a virtual silent drum roll, please. Yes, okay, I can almost hear it. It's almost here. In second place, our runner-up of the HealthTech Startup Week event is Telehuman. Shout out to Jessica and team. Great job. Excellent presentation. And Darren, if you will chime in a little bit about why Telehuman.
Yep, thanks, Susan. Right, echo that. Congratulations, Jessica and team. Very nice job tackling a huge problem. Crucially, what was important to us in the judging room is that it was well validated with customer discovery, and you backed it up with real numbers. So this seems to be a problem just asking for a solution. And it looks like you got it. You're on the path for execution of this. Your challenge will be to discover how this amazing solution to a huge problem is irresistible to everybody in your ecosystem. That means everybody who has any say as to whether the idea is adopted, makes money, or is otherwise super happy about it. So that's your challenge going forward, but I expect you'll figure it out. Good luck.
Awesome. Congrats, Jessica and Team Telehuman. Your $500 cash prize coming your way after today's event. All right, so if I can get one final and bigger Zoom virtual drum roll, please. Yes, thank you. Okay, Nate, that is like, if there's like a conga drum roll, I'm very into it. Okay, first place, the winner of the HealthTech Startup Week event, Team Cutiescope. Great job, guys. Excellent presentation. You kicked us off with an excellent presentation, excellent design. And if I can, I'll give the floor to Florence to say a few words about why Cutiescope ended up being the winner today.
Thanks, Susan, and congratulations, Naveen and Fiera. You guys did a great job. I do want to say I thought all the teams were really good, some really interesting ideas, and shared this little piece of advice that it's 5% to steal something from Thomas Edison. Maybe it's 5% idea, 95% execution. So, but you guys did a great job, Naveen and Fiera, on you kind of hooked us with that human interest story, the one person whose problem you'll be solving. I have a bad memory, so I don't remember her name, but she had a face, she had a name that was excellently done. You had good market research. So all the criteria that we were asked to evaluate you on, validation, the execution, you had thought through what your solution would be. And I think you were able to acknowledge that there were things that you still would need to figure out. So I thought you did a great job. And not just me, the rest of all the judges thought you did a great job as well. So congratulations, good luck, and wish you all the best.
Thank you so much.
Thank you all for the feedback.
Awesome. Thank you so much to all 4 judges for watching today's presentations, asking great questions, providing great feedback. All in all, really good experience from the judging side. You guys are great and easy to work with. So congrats again to all the teams. I only picked 2 winners today, but hopefully, you guys all learned, whether or not it's with this venture, you all learn the skills that you can use in the future to apply as you come up with new ideas and work to validate them in the market.
Susan, can I say, I want to see all these products out there.
Yeah, for
sure.
Real.
So
for sure.
Get them out, guys.
And that's a good transition point, because the last thing for today, I'm going to pass it off to, I think, Jenny, to talk about some additional community resources that you guys have to continue pursuing your ideas. So one additional resource or continuing resource is through Techstars with more Startup Week or Startup Weekend events. So I encourage you guys at your various universities to watch the news and look out for those, but know that they also happen in non-university settings. So if there are cities surrounding you that may be putting them on, you can always jump into community events as well. So if you like this, do it again next time you see those pop up. They're happening more and more often again now that things are getting back up and running. So look for more Techstars events. And then Jenny, you want to share?
Yes, I will. Go ahead and share my screen. And I do want to say congratulations to everyone. Honestly, you guys did an amazing job. I know you put so much work into this, and I'm always so impressed with the end result. So hopefully you learned a lot out of this. I also want to give a huge thank you to our awesome facilitator, Susan. It's been wonderful working with you. It's been a lot of fun. I've had some good times this last week and pre-planning as well. So, and of course, thank you. This all can be possible without our mentors and our judges, people that were there, at the beginning of mentorship and then the end, trying to help with the pitch sessions and whatnot. So thank you to everyone that's joined us. But I'm wondering, I'm sure the teams are thinking, okay, wait, what is next? And absolutely, Dave said, as he said, the iCore program is a top-notch program that you should absolutely look into, and I actually think is pretty applicable to everyone here. But there's a wide range of ways you can get involved, whether you're going to further this venture or you just still kind of want to explore different parts of entrepreneurship. So first things first, we all come from different schools, but most of us come from Blackstone Launchpad schools. So we all have a Launchpad. We're all very open to hearing from you. We want to help. Every campus that has their own campus director has their own programming, and really it's a great community and network to be a part of. For UCSF, and of course anyone is welcome to join us. It's completely open, but join our community online. We have a Startup Tree account, and this is where we post our events that we're going to be holding, different opportunities that might be available for you. There's job postings, there's ways to get a hold of mentors. So this is, we just launched this a few months ago, but this is rapidly growing into like where our community is home is to connect with people. So other things you can do, like small things, you can just attend some of our events. In fact, we're having one this Thursday. There's going to be a fireside chat with a founder and CEO of a biotech company. Charles Hart is going to be moderating that. And that, again, you can sign up on Startup Tree. But come talk to us. We are absolutely open and want to help. Like I said, we're a really open community, and we can point you in different directions depending upon what your needs are. Like I said, I-Core is very applicable to people, but some people, our team also runs a Catalyst program at UCSF that may or may not be applicable to you. UC Launch is another great accelerator run out of Berkeley that I've sent teams to. So we can kind of match your needs with what you need at the time. Our Blackstone Launchpad whole network also has its own programming. Again, the Launchpad network is now 46 schools big. It just increased by about 15 or so. But we run speaker series, again, different fireside chats, informational sessions, just places to learn and hear of different experiences. Like I said, mentioned earlier that John was a part of, we have a fellowship program. It gives you, again, a little bit more in-depth training. It's kind of self-led though, with some mentorship and workshops, but you do get $5,000 to really, focus on your venture. These are previous UCSF fellowship awardees. Like you mentioned, John, we have Nikki of IIAM Health. She's actually also a Catalyst awardee right now. And we have Stephen, who's an MTM student who's been helping us run this program. So again, we're all kind of a close community and helping each other out. Above and beyond that, the Launchpad, as you get further and further down, they have pitch competitions and demo days with larger scale amount of money. And this is our own Gopikaner from UCSF, who went from here to be a Catalyst awardee to being in Skydeck Accelerator, and now she's out, raising her $5 million. So, it can definitely happen to any of you guys. So that's all I had to say, but definitely keep in touch, and you guys did an amazing job, and I hope you keep going forward.